As I recall this message, we are waiting the outcome of national decisions as to whether we will see the final lifting of restrictions on the 21st of June. It is possible that given the situation with what's now called the Delta variant of the COVID-19 virus, that we may see some delay to that. I thought I'd concentrate today on the milestones and the criteria that the government will be looking at and to see how we stack up in Torbay according to those 4 areas that were set out earlier when the roadmap was first given to us. Our background rates in Torbay continue to be low. We've seen a small increase in cases over the last couple of weeks, and that is probably not unsurprising because the last set of restrictions, particularly allowing activities indoors, we knew would increase the chances of people interacting with each other in enclosed spaces where we know the risk of transmission is higher. So to some extent, a small increase in cases was expected and in and of itself is not a cause for concern. But overall, our background rates remain low. We do not yet have any evidence of transmission of the new Delta variant in Torbay, or indeed of any of the other variants. And it's important to remember that this is a global pandemic, so new variants will continue to emerge. Those variants become important if they transmit more easily. And that is why the Delta variant, one of the reasons why the Delta variant is such an important one for us, because it is more easily transmitted than the current variant, which is now called the Alpha variant. And that means that we can't take any risks with the measures that we have in place, because this virus will exploit any weaknesses in our personal or public health defenses. The second concern about the variant is that it might escape vaccination protection and cause more hospitalizations, more severe disease. The preliminary evidence is suggesting that although it is the vaccines currently are not as effective, they still offer a great deal of protection, particularly when you have 2 doses. I said that the new variants are not here yet, but we know that the Delta variant is now establishing itself as the dominant variant in the UK. And it's only a matter of time before it comes to the Bay. A couple of things important to note. The COVID virus has never left Torbay, and it is as likely that any new variant is going to be imported by residents in the Bay who are getting out and about and doing their usual activities, visiting family, friends, conducting businesses elsewhere. It's as likely that it will be imported that way as it is likely that it might come in through our tourism industry. I know there are times when we think that it's because we have a hospitality and tourism sector that anything that comes is likely to be imported that way. That's not necessarily the case. I know that our businesses, our hospitality or tourism, accommodation sector have really pulled out the stops because they understand how important tourism is to their livelihoods and to the economy of Torbay. And I just want to recognize the very hard work that the vast majority of our local businesses and tourism operators have been putting in, the great efforts to make sure that they are operating safely, both for our residents, but also for the many visitors who are already coming. The third aspect to look at is what's happening with NHS services. And generally speaking, we've not had any COVID hospitalizations or deaths for many weeks now, and that's really positive. But that doesn't mean that the NHS isn't under pressure. Clearly, the NHS has to deal with the impact of not being able to operate services in the way that we've been accustomed to over more than a year now. And many of us are needing to return to care. The NHS is continuing to find innovative ways of meeting those needs. But we know, for example, that the emergency departments have been under considerable pressure. And it's important that we protect the NHS not only by preventing cases of COVID-19, but also thinking about some of the avoidable illnesses that can place pressure on emergency systems, for example. And one can just think about our nighttime economy and about thinking about drinking responsibly so that, for example, you don't get as much of the impact of excess and binge alcohol in our emergency departments. These are some of the things that we can think about in terms of helping our NHS colleagues who have been at the forefront of a very difficult period. The last step is about vaccinations, and in Torbay we have very good vaccination cover. That is something we continue to be proud of, the efforts of our NHS colleagues and others who organize what has been a really world-class logistic operation to vaccinate our residents. To date, about 2 out of every 3 adults now have had their second dose, and that's really positive. The vaccination offers really good protection against COVID-19 and its variants. But of course, no public health measure on its own is 100%. And therefore, we want to encourage as many people as possible to have their vaccination. The benefits of vaccinations far outweigh any risks. In fact, the risks of severe complications are very, very rare. There was reports about blood clotting, particularly with AstraZeneca. That occurs probably in the region of 4 per million doses. So it's important to put that in perspective. Younger people are less likely to have severe disease with COVID-19, but they can become infected. And we know that 1 in 10 or more people have persistent symptoms of COVID, called long COVID, which can affect their ability to work, their ability to look after themselves and others, and those symptoms can persist for many weeks, 3 months or more. So it's important that we encourage people, when you are invited to have your first dose or your second dose, to please take that opportunity. The higher our vaccination rates, the better our chances of keeping COVID-19 cases low and preventing any further impacts on the NHS. Ensuring that we can have our tourism sector operate safely and give that confidence to visitors and to residents that they can go out and use our businesses, use our hospitality sector safely and responsibly. Whatever happens after the 21st, or whichever date the restrictions are finally lifted, it's important that we understand that all the public health measures are important and will continue to play a part. Vaccination is by far the most important protection that we can offer. But we also need to be able to pick up any new cases early, and that's where testing becomes important. Whenever people are out and about, whether you're working in situations where you are in contact with people that are not in your household, etc., It's good to establish a habit of testing, and we think twice a week of having asymptomatic testing is a good strategy to have in place. And that's supplemented by hand hygiene. Hand hygiene is not only going to help us against COVID-19, but is going to protect from many other illnesses that are transmitted in that way. We continue to use facial coverings and face masks, particularly when we are in close contact with people who are not from the same household, and as much as possible to maintain social distance, particularly when we are meeting with people who are not part of our social networks and social bubbles. If we do all of these things together, if we continue to maintain vigilance, I believe that we can keep the COVID numbers low and we can get on with our lives, have a semblance of business as usual without COVID dominating our lives in the way that it has over the last year or more. I think we have made a lot of progress, and it's important that we keep that momentum going as we go through the month of June into July. Thank you so much.